are crystals that form within the urinary system or the kidneys. They affect about 10% of men and 5% of women. They're commonly composed of calcium and oxalate, but they can also be composed of other minerals including uric acid and struvite. It's more common in men and slightly less common in women. Individuals who have diabetes are at increased risk of kidney stones. Dietary changes can reduce a patient's risk of forming another stone from about 50%. It's those patients that really benefit from coming to a center that specializes in kidney stones that can treat them both for complex stones and multiple stones with the latest surgeries, but also really focus on prevention using the current state-of-the-art approaches, both with specialized testing to understand why they're forming the stones, dietary changes that may be necessary, and in some patients, medications as well. One of the newer approaches that we offer our patients at Keck Medicine of USC for their complex kidney stones is mini PCNL, which is a less invasive form of what's known as percutaneous stone surgery. Using smaller instruments, we're able to make an entry into the kidney about the size of a straw and be able to completely clear the stones in most patients in one surgery. In addition, because we're using such a small entrance, the patients tend to have less pain, less bleeding, less infection, and they often can actually go home the same day as their surgery.
We started with ESWL in 1982. Initially, we started with very small stones, and we broke them, and nature took care of it. When you have a bigger stone, you better go directly to percutaneous surgery, where you make a track into the kidney from the outside. Go into the kidney, break up the stone, and take it out directly from the kidney. The majority of stones that we encounter, are such complex stones where we have to combine technology, where we go from the side. There are areas when you come from the side, you cannot make very tight turns in order to reach areas in the kidney, but when you come from below, then you can make that turn, move these stones into the center, and then from the outside we pull it out. You use laser technology on the central renal stones, where simultaneously you can use shockwave from the outside to break up the peripheral stones. Then from the approach from below, you can remove stone particles using stone baskets. Same thing with percutaneous surgery, where you go in through the side in the kidney and simultaneously you come from below, so that you can reach each and every part of the kidney and clear out complex stone material. For the patient coming to USC for stone treatment, I think the most important thing to know is that all the technology is available and is used in the right way, that there are no biases. When we have a stone in the ureter that's obstructing and causing trouble, and we have multiple stones in the same kidney, we usually take care of the urethral stone and the stones in the kidney as well. When you come here, you get the best one-time treatment with the least possible complications. Regardless of how complex the situation is, or regardless of what the medical comorbidities are, because often many of our patients have medical comorbidities, have a coagulopathy, are on anti-coagulant medications that they have to be on, then we have to be extremely precise not to cause any bleeding problems. Those are the things that we do.
One of the most meaningful things that we've done for patient education is get involved with patient advocacy groups. We inform and sit on the boards of a number of patient patient-centered groups so that we're not just giving lingo and giving feedback to patients that they don't understand, but we're helping feed it through patients who have kidney stones and then helping them write and disseminate recommendations to patients that they can understand and that they can actually incorporate into their life rather than having to figure out.
The future for kidney stones is really focusing on prevention and partnering with patients in making sure that they have their diet appropriate to prevent stones and doing metabolic evaluation. And I want patients to know that there are steps that we can take to better understand why they're forming stones by doing the appropriate metabolic testing. And then based with that knowledge, we can help them prevent future stones and prevent them from suffering from stones in the future.